Hi guys, welcome today to today's lesson. We're going to be discussing about malaria. We all know it's a prevalent condition, especially in Africa, in the tropical regions, and it have a very good prognosis depending on the action taken on the drugs. So Malaria it's a protozoan infection caused by a female Anopheles mosquito. It's a bite. Malaria has different parasites including Plasmodium species, which include um, Falciparum, ovale, vivax, knowlesi, so and others also. So we want to look at the symptoms of malaria. What would make you diagnose malaria? So we have the following symptoms. If a patient comes with chills, chest pains, chills, sorry, joint pains, diarrhea, vomiting, and muscle pain, back pain, you're looking at very many factors here. Abdominal pain, headache, fever, all of them, they all mean that this patient could be having malaria. So which are the blood tests that you do? So we can do a blood study for malaria parasites. It will show how many parasites are there. And also we can do something called the random diagnostic test, or otherwise famously known as the RDT. So those two tests are very crucial in identifying the malaria parasites in the human body. When you are actually bitten by a female Anopheles mosquito, the parasites go to the liver and they infect the red blood cells. So it's very fatal sometimes. So actually there is complicated and non-complicated malaria. So non-complicated malaria is just a normal malaria whereby the patient is stable. But when it comes to complicated malaria, also known as a severe malaria, a patient will present with very many fatal complications including hyperpalexia. We have jaundice, which is detected clinically. We have anemia of less than 5 milligrams per deciliter. We have heavy parasitemia of more than 100,000 parasites. We have acidotic breathing. We have actually very many factors that actually will tell you if the patient is very febrile. Um, these are one of the most, actually it's very rare, but it's very easy to treat. So what are the treatment for complicated malaria? Remember I said complicated malaria is whereby there is a vital organ dysfunction. That's how which is detected either lab or in any physical exam. So how do you treat complicated malaria? So the first line is artesunate. Very simple, very actually affordable, and it's actually available nowadays in almost all hospitals. And then we have the second line, which is quinine. It was first line around 3 years ago, but then it has been replaced by artesunate. So now we have been able to manage complicated malaria. Now we go to uncomplicated malaria. Uncomplicated malaria is actually also very simple again. Just give artemether lumefantrine tabs 0 hours, 8 hours, then 12 hours for 2 days. And that's all. You have managed malaria. So I've taught you the definition, the symptoms, the lab investigations, and the treatment for malaria, complicated in both. So I hope that I have taught you anything that is very vital in malaria. If I've left out anything, please comment in our comment box so that I can review and actually go back to you. Thank you. I hope that everything that I have taught today might be simple, but it's very vital. Thank you. See you next lesson.